into the next part of the program, which is to recognize the award winner of the Canadian Collaborative Mental Health Care Award this year. So I'm really thrilled to welcome Trish. I'm just going to take a quick moment to explain what the award is and your program. And then if you want to kind of just take 1 minute, if there's anyone else that you want to recognize, or, you know, we'd love for you to have a chance to speak. Normally we would do this on the stage and I would pass you this really cool plaque, which we will instead have to ship you. But I so appreciate you taking the time to join us for a few minutes. So for those who aren't familiar, the CFPC and CPA have a collaborative mental health care award that highlights important work being done in communities across Canada to improve access to effective mental health care, enhance mental health care service delivery, and increase family physicians' capacity to identify and meet the mental health care needs of their patients. There's one award that recognizes a grassroots community program or service providing access to mental health care in a primary care setting that involves excellence in interprofessional, team-based collaboration between family physicians and mental health services or providers. And then there's a second award that recognizes larger kind of institutionally supported program, again, with a similar kind of interprofessional team-based emphasis. And this year we are very pleased to be recognizing the CBT Skills Group program, which is a grassroots program based in British Columbia. And with me to receive the award is Dr. Trish Nozick, a family physician. And there are additional members of the team who include Drs. Erin Burrell, Joanna Cheek, Wanda Kraus, Melissa Gansner, and who are all psychiatrists, and Drs. Marjan, I'm sorry, Blau, you'll correct me, Trish, if I get them wrong, Lauren Dake, Virginia Gooderham, Una Hayes, Laura Spratt, and Jennifer White, who are all family physicians. And the CBT Skills Group program is a physician-designed and led series of group medical visits for adult patients, 17 and a half to 75 years old with anxiety or depression. And it integrates basic neuroscience concepts with introductory mindfulness and CBT skills and teaching. And it's delivered in an 8-week series of 90-minute group medical visits with up to 16 patients per group. And the family physicians in BC have reported that a large proportion of their practices are devoted to addressing mental health concerns, but there are often resource shortages, access issues, weight issues, and systemic barriers to providing early intervention for patients with mild to moderate illness. And so this service, which is offered at no cost to patients, was really creatively designed to leverage models of funding for group medical visits in the Universal Healthcare Coverage plan in BC with the support of Doctors of BC and the Ministry of Health. There is lots more to say about the terrific work that was done around implementation, planning, a 200-page workbook, and training for family physicians. They even had continuing education credits for it, just like very, very thoughtfully designed to develop capacity and improve access. And so when I had the chance to read about this program, it was just very inspiring, and so glad, Trish, to be able to recognize that with you here. So, and I will just also mention that Dr. Burrell and some other colleagues are actually presenting about this program in the main conference that we're doing in partnership with CFHA over the next few days. And so I hope that people will also have a chance to learn more about the program there. But with that, I'll hand it over to you, Trish, if there's anything else that you wanted to say while you're up here on the virtual stage with me.
Great. Well, thank you very much. It's a real honor to be just a tiny little part of a very big team. And Nadia, you described things beautifully, and you got almost all the names correct. Mine's one of the harder ones, and you did that one all right too. So that's great. Thank you for that. I just wanted to say that it is a real honor to be recognized for all this work, and this is our team. And I really have to give extra credit to those psychiatrists and initial family docs who were the ground grassroots team at the very beginning, who started this several years ago now, six or 7 years ago is when we began. It's a real privilege to be a part of something that empowers us as family doctors. I feel like I have so many more tools, so many more things I can offer to people, but also to really see how patients are empowered by this. I always say that my passion is for those pre-psychiatric patients. I want to keep people out of the psychiatrist's office. And these are really super mental health hygiene tools that we introduce people to. And it's a really exciting and really fulfilling part of my job to be able to be offering these groups. So thank you so much for the recognition, and on behalf of the whole team, which is hardworking. And I hope you will go to Erin and Ocean's presentation later and get more information about it. But we're proud to be here and thankful to be recognized. Thanks.
Thanks, Trish. Your program is such an inspiration. So congratulations again, and look out for the plaque in the mail. and so appreciate you joining us for a few minutes.